Project has been worked on for the past, feels like about a year, since we first started having the discussion as we were designing some property, some space within the building for gross motor space for our students. And as that process was taking place, one of our board members said that the hospital was looking at doing something very similar and suggested we have some discussions about sharing space. And so that's where we initially got started with this project. It grew from that into FirstLight office space, including some courts and some indoor tracks and indoor walking track. This is going to be a wonderful, wonderful opportunity for our community, for our school district, and for our students to be able to have a large space for gross motor activities such as basketball, volleyball, walking, to assist with some diabetes management, some weight loss management, and all of those types of things, services that the hospital is currently providing. Today I'd like to recognize board members that have been working on this from the school perspective. We have Scott Moe here today, who's on the board. We have Bob Jensen, Karen Kirchner, Ethan Elvigem, and Tammy Bohatchik, who I can't quite see back there. I'd also like to introduce Randy Alseth, who is the CEO at the hospital. We first started having these discussions. Do you remember, Randy? Was it 12, 14 months ago, something like that?
It was a long time ago, yeah.
To get us up to this point. So Randy, if you'd like to recognize your board members as well.
Sure. First I want to say, actually the first time I had any kind of a conversation about this, it was a text message conversation with Brent Nelson. He sent me a text. I don't know if we were both up in Hill City at our cabins or what, but sent me a text about how does FirstLight Fieldhouse sound, and it sounded great. We really that was the beginning of the conversation, and then conversations with our staff and our board, and what we really want this to be is we decided is really a place for our community to come together, and that's where we got the name FirstLight Community Wellness Center. And it's important to us to create a more healthy community, more healthy communities. We do want all of the communities we serve involved in this, and there's been a lot of conversation about the other schools in our service area being able to use this space, as well as our community. There's a great walking track and some opportunity to learn how to exercise. So we are very, very excited about this. Our board stepped up in a big way. I threw around a number early on that I was a little nervous throwing around, and the board went beyond that. So I definitely want to thank our board chair, Terry Hagerness, for her work involved in that. Terry. And Stephanie has also joined us. And Becky, thank you so much for your work and commitment. This is a big commitment. Rural healthcare is not the easiest thing to do right now from a financial perspective. So they're making a huge investment in the community. They've done a great job. My entire board has. They couldn't all make it today, but if you happen to be visiting with one of them, thank them for their investment in this. It was not an easy decision. So
thank you, Randy. And Randy, I'd like to thank the hospital for working very specifically, publicly thank you guys. As you mentioned, this project started out and it worked its way through a process. Both the school board, the hospital board, your employees, Deb Wright and Garrett, were very involved with helping us design and lay out this process. It's been a fantastic opportunity both for the school district to increase our square footage, but also to provide square footage for the hospital for their space and their commitment. I've heard a number of times that wellness dollars invested have about a 3-to-1 return. And so this is really truly an investment in the community and the wellness of the community. So again, publicly, I'd like to thank you and your hospital board, along with the school board, for making this happen. Without you guys, this would not have happened.
Absolutely. I can't wait to see what Deb and Garrett are going to do with it.
Next, I'd like to introduce Arif Qureshi. He's with Foster Jacobs and Johnson. He has his team here today to, and this will be the company that will be helping us, help us with the design, They'll be leading the project as far as the groundbreaking through all the way through completion. And so Arif Qureshi from Foster Jacobs and Johnson.
Great, thank you very much, Craig. First of all, let me tell you we're very excited about being part of the community and actually working with the community. We have been involved now for almost 3 years on the Trailview project. We're really excited about the Wellness Center. I think it's going to have a big impact on the community. We see it in other smaller communities that we work in. I do want to take this opportunity to thank some of my team that's been involved in the project, specifically starting off with Damien. Damien is the project manager on this. All school projects, all projects like these are very fast-track projects. He's been putting a lot of hours and time, and I think you'll see the results of that, not only on the Trailview expansion, but also on the Wellness Center. The other person is Joe Bry. He's probably hiding because he's the site superintendent. Where's Joe? Okay, he doesn't like to be in the limelight because he's probably involved with a contractor dealing with an RFI or a change order, so that's probably where he is. He's also been involved in this project from the start. He'll also be involved in the Wellness Center project, and our senior project manager, Brandon. Along with that, we have 125 people in the company that are really committed to this project. We've been working behind the scene on this to bring it in on time. I think that's critical. The district needs the space. So our plan is to really get the project moving extremely fast. As you know, we bid it out. It came a little bit under budget, which is very exciting for this time of the year. We're looking at getting the project up and running in January, so you have the space that you need to occupy. It's always a fun project like this because I think it has an impact not only on the kids, it's actually going to have a massive impact on the community as we move forward. So again, thank you for the opportunity the district has given us to work with you, and we're really excited about this project. Let's get it moving.
I just wanted to give you an idea of what we're talking about with this Wellness Center. Size-wise, you'll have to do a little bit of imagining, but this building will run from the south end of these two gyms. This is the old gym on the south and the new gym on the north. It will be run right alongside of that building, all the way up to where it connects with the path, up just on the other side of that steel fence. From that corner of the path, over to my silver pickup in the far corner over there is 135 feet wide, and from my pickup down to that garbage can down in the parking lot down here gives you an idea of how big this building will be. It'll be 135 feet wide, and from one end to the other it will be 300 feet in the gross motor space, with another 40 feet of office space, storage, and two-story building on the end of that. So from that garbage can to that silver pickup over there is 340 feet. That's over the length of a football field. Again, that gross motor space will have 4 full-size courts. It will have an indoor Minnesota State High School League running track, as well as an elevated walking track that'll be 10 feet wide, elevated 12 feet above that. So there's going to be a lot of space for a lot of activity. The walking track alone is about 9,000 square feet. And I wanted to know myself how many people, what's the maximum we can have on that walking track at a time. And I was told that it does 100 pounds per square foot. So at 9,000 square feet, that should hold about 900 people. Now, it might be very difficult to walk in that type of a setting, but I don't think we're going to have to worry about over maximizing that space. But it will be space for this community that can be used year-round. It will be heated in the wintertime, thank goodness, not like our outdoor facilities, but it'll also be air conditioned in the summertime. And so if you're a person that likes to walk, a community member that likes to walk or participate in any of those types of things, that will be open to you through our Community Ed program. Again, thank you for coming today. We also have our 5th grade here today. Our board members, as was mentioned, we're going to have the photo opportunity. We're going to take a number of pictures with a number of different groups of people. Since this is a joint venture, this is very, I'm not familiar with this. This is a little different than any other project I've worked on. Every project I've worked on has been either a school project, or I was on the hospital board for a number of years and worked on a hospital project, but this is the first time I get to work on a joint school and hospital project. So personally for myself, this has been very, very fun to work through this process, and I'm really looking forward to what this will mean for our community. If any of you would like to stick around after this is over with, Randy Quall, our elementary principal, will be giving tours of our newly completed space. We did add a new gym on the north end here, as well as we've added classroom space for kindergarten, first, second, and third grade. That was the bond election that passed. You may have noticed if you drove by here earlier there was all kinds of activity, but the new part is pretty much completed. We're waiting for school to get out to do the tie-ins and the remodeling, and that portion will be ready when school starts in the fall. And as was mentioned then, by the 1st of February we will be in this new space as well. I can tell Deb, I think I'm really excited about this, but I think Deb is probably even more excited, as that will be a big piece of what her space will be as well. So really looking forward to that February 1st. Hopefully we'll be inviting all of you back in February for a grand opening, and you'll actually get to see more than my truck and that garbage can over there from our completion point. So again, thank you for coming today. If you'd like to stick around for a tour afterwards, fantastic. Randy will be giving those. And again, thanks for coming.